Hello, my name is Shaun Mccann. I'm a hematologist. I have now retired, but I initiated bone marrow transplantation, HSCT, as it was known then, in my country, in Ireland, and carried out the first allogeneic bone marrow transplant in 1984. I was subsequently appointed as National Medical Director of the Blood Transfusion Board by the Minister for Health during the hepatitis C crisis. And during the last 5 years of my career, I was responsible for the running of the undergraduate medical school in Trinity College, Dublin, in Ireland. I have a long-standing interest in wine and wrote a column for the Irish Medical Times for 18 years under the pseudonym Giovanni Morelli. I have written an invited editorial for the journal Bone Marrow Transplantation on wine and blood since 2018. Now, since I've retired, I spent about 6 months a year with my wife in our house in Tuscany, in Italy, which is a famous winemaking area. Although it may not seem obvious at first, there are many affinities or similarities between winemaking and hematopoietic cell transplantation. These affinities have been the subject of my editorials for the journal Bone Marrow Transplantation, and I will allude to these during this webinar. First, let me give you a very, very small amount of history. Winemaking probably began in Mesopotamia and was developed thousands of years ago and was developed by the Greeks and the Romans. Now, of course, it is ubiquitous and takes place in countries as far apart as China, Moldova, and Tasmania. And I must say that wines from France, Italy, and North America no longer enjoy a monopoly on the world stage. Vitis vinifera is the commonest vine used for winemaking around the world. And one of its characteristics, which makes it very attractive to wine farmers, is that the vines are hermaphrodites. That is, they contain male and female characteristics on the same plant, making pollination, of course, very easy. Blending of different grape varieties was very common until about 150 years ago, but now there is a drive to produce wine from single grape varieties. For example, some wines from China are made from Chianti are made entirely from Sangiovese grapes. You need to also remember that fashions change in winemaking, just as in clothing and other things. And what was considered to be the best is no longer sought after. Anyway, whatever about your knowledge of wine and winemaking, remember it is there to be enjoyed, and like many things in life, a little knowledge may enhance your enjoyment. Now, if we try and compare winemaking and hematopoietic stem cell transplantation, I have a couple of slides here which I think show or illustrate some similarities and some differences. Okay, the first slide shows the purported changing of water into wine by Jesus Christ at the marriage feast at Cana. And this is probably one of the earliest and well-known, at least in the Western world, images of winemaking. And of course, anybody who's involved in hematopoietic stem cell transplantation or bone marrow transplantation, as it was known, will know the figure of John Thomas, who won the Nobel Prize for his development of transplantation, and of course, for many years, and probably still is, known as the king or head of bone marrow transplantation. So between setting up a vineyard and a bone marrow transplantation unit, there are many questions which have to be asked and many decisions which have to be made. Where to plant a vineyard? Well, First of all, usually in most countries, vineyards are south-facing and there is good drainage. In other words, they're usually on a slope where the rain or water can drain off. And of course, you have to have sunlight to convert the sugar and the yeast into alcohol. In terms of transplantation units, well, all around the world, they are usually situated in a large teaching hospital. And the only thing I would say is that, it may seem very obvious and perhaps somewhat trite, is that transplant units should be easy access for patients, because obviously it's a fairly traumatic procedure. Now, we try to get staff training. Now, this is somewhat difficult. In many countries, the people who pick the grapes are workers who come from abroad. And this was a huge problem during the COVID pandemic, when, of course, many people were not allowed to travel. But in some of the larger vineyards and well-established vineyards, the grape pickers will live on the vineyard the whole year round. And of course, many of us who were medical students in the years gone by, and some of you not such a distant past, will know that grape picking was a way of earning small amounts of money for medical students during the summer. In terms of transplant units, then you have to try and attract staff and to train them into the things to do and not to do. And this is not always easy, and sometimes you may come across some resistance in staff to the somewhat draconian rules which apply in transplant units. Access, access to vineyards isn't really terribly important unless you're heavily dependent on the tourists, which is probably most common in places like in California. It may seem, again, I rather try to say that access to hospitals and to transplant units should be made very easy, because this is an extremely stressful time for both the patients and for relatives. Now, something that you probably don't think about is that access to vineyards is extremely important for large vehicles. So bringing barrels, bringing corks, transporting wine requires large vehicles, and access can be very difficult. And in parts of Italy where I live, they have what are called the Strada Bianca, or the white roads, and some of these are really very primitive and make access to the vineyards rather difficult. In terms of a bone marrow transplant unit, then it is important that you are preferably on the site, which we have in St. James's Hospital in Dublin. We have a large blood bank, and we also have molecular and HLA typing laboratories. So if you haven't got the ability to have these on the same site as a transplant unit, then they should really be very easily accessible. Okay, what do you need? Well, what you need to grow grapes is sunshine, radiation. And really, that is something that we cannot control as yet anyway. But certainly, as we know, the manufacture of wine is the conversion of alcohol by the sugar in the grapes and also by the fungus on the skin, their interactions. So having a sunny climate, and this will vary in different parts of the world at different times of the year. In terms of radiation for hematopoietic cell transplantation, well, access to radiotherapy, of course, total body radiation is important. Initially, certainly when I started transplant, we used single fraction radiation, which is quite toxic, but now fractionated radiation is preferred by virtually all units. So a good relationship between your radiotherapy unit and the transplant unit is essential. And again, preferably having them on the same site. A number of people, George Santos in Baltimore being probably the best known, developed, and there are many, many different schemes now of chemotherapy, which are myeloablative, which are used in preparation for hematopoietic stem cell transplantation. And of course, radiotherapy is not required. So you don't necessarily have to have access to a radiotherapy unit, but in most transplant centers, this is readily available and is still commonly used. Okay, other decisions which you have to make. Well, in terms of vineyards, there's a lot of debate about the use of sulfur. And you will see the symbol here, which is on many bottles of wine, indicating they're organic. Now, many people assume that this means that no sulfides are used, which is incorrect. In fact, even people who make organic wine do use sulfides, although the amount of sulfides used in organic wine is usually less than is used in non-organic wine. Some people in the past have developed or blamed, shall we say, sulfur on the headache associated with red wine drinking, but this probably isn't true. And most of the headaches after red wine drinking are probably because you drink too much wine and nothing to do with the sulfur content. In terms of hematopoietic stem cell transplant units, well, I think everybody will now use what are called right atrial catheters. Now, these were developed by Bob Hickman, with whom I worked in Seattle, as a means of venous access. And they certainly, without them, I think it would be impossible to keep patients alive following high-dose radiant and/or chemotherapy and allogeneic stem cell transplantation. Whether one uses prophylactic antibiotics or antifungal is really still a matter of choice and will depend a lot on previous experience of transplanters in their own units. So in some units where fungal or bacterial infection is common, then they may be used. But in general, people do not use prophylactic antifungals or antibiotics, but use them when they are necessary. And we'll come to that a little bit later. Now, infection is something that bone marrow transplants and stem cell transplanters think a lot about. The infection is a common problem in transplant recipients and is also a common problem in vineyards. Now, many of the infections will be fungal infections, both in humans following a stem cell transplant and also in vineyards where grapes are grown for the making of wine. So it is very important for the person in charge of the vineyard to have a good knowledge of the sort of fungal infections which are likely to occur in their particular vineyard. The infection which caused the huge problems in the late 19th century and early 20th century in Europe and almost wiped out the wine industry completely was phylloxera, which was imported from North America. Most of the vines in Europe had never been exposed to phylloxera, and when it was imported to Europe, it had devastating accounts, killing thousands and thousands of vines and grapes all over Europe and also other countries as well. Now, whether one should use prophylactic antifungals or insecticides, again, will depend in the vineyards, your knowledge of the history of that particular vineyard and the climatic conditions at the time. For example, because there was quite a lot of rain in certain parts of Europe this summer, and in the autumn, fungal infection was more common. In terms of humans after stem cell transplantation, well, infection initially was due to, or was thought to be due to at least gram-negative infections, although certainly in my experience, gram-positive infections were making a huge comeback. But people rarely died from bacterial infection, even though they were profoundly neutropenic, had mucositis, and even graft versus host disease. However, fungal infections became, and still are, of extreme importance in terms of humans who are neutropenic following transplantation. Now, fungal infections are difficult to diagnose. And of course, the early and aggressive treatment of neutropenic fever is important, and the early addition of antifungal agents is important because the diagnosis and the growth of fungus in the laboratory is extremely difficult. Probably the most important and devastating fungal infection known to transplanters after transplantation has occurred is infection with Aspergillus, and I show here a picture of the Aspergillus infection. Now, the problem with Aspergillus, well, there are three problems. One, it can be a cause of death. Two, because Aspergillus invades blood vessels, it leads to infarction, which leads to hemoptysis, which can, of course, be life-threatening. And thirdly, it is extremely difficult and rarely possible to diagnose fungal infection in the laboratory. So a lot of use is made of, first of all, you must be aware that this is a possibility. And secondly, close contact with radiology colleagues is extremely important. And high-res CT is probably the best way. As you can see the infarcts clearly on that, and you know that the most likely diagnosis then is of Aspergillus, and appropriate treatment can be instituted. So knowing what the local flora and fauna are in your vineyard or in your transplant unit are extremely important in making a decision about what the likely cause of infection is and what the likely treatments are going to be. Now, we want to go on to our next slide. Okay. The major problem affecting transplanters is, of course, graft versus host disease. And this has been a bugbear of transplanters since the 1980s, and actually is still not completely eradicated, and still can contribute to or be the cause of death following allogeneic stem cell transplantation in about 20% of cases. I've shown some slides here of the appearances, histological appearances of graft versus host disease. However, there is a huge clinical problem between what you see clinically and what the pathologist will grade in terms of the biopsy. So often a grade 4 biopsy changes will be associated with a fairly mild rash which responds to steroids. And in fact, some clinicians, Jamie Ferrara being one, are moving away from the pathological diagnosis or grading of graft versus host disease, as they find it unhelpful and sometimes even confusing, and are looking at other ways of diagnosing graft versus host disease. But for the moment, we rely on our clinical diagnosis and our pathological grading of the biopsy. Now, the standard prophylaxis used by Don Thomas and his colleagues was methotrexate, and then cyclosporin was added. Now, there are many different ways and different uses of prophylactic agents in terms of prevention or treatment of GVHD. However, I think it is probably reasonable to say that steroids are still the initial treatment of choice, and graft versus host disease, which is resistant to steroids, usually is resistant to everything else, and unfortunately is associated with severe morbidity in the long term, and of course with more mortality. Mortality usually due to severe infection, which doesn't respond to the appropriate therapy. Now, other decisions which have to be made in vineyards and in transplant units. Well, farmers in vineyards have to decide what sort of fermentation tanks to use, and there are huge choices and huge variations. I'm happy to say that a number of transplant units still use concrete, which was used by the Romans and by the Greeks. So some things that are old are still quite applicable and go for making good wine. Amphorae, which many of you will know from pictures of Greek and Roman, on Greek and Roman vases, are coming back into fashion again. Many people use oak barrels, and these can be American or French, or they can be Slavonian. And many people, or many vineyards, winemakers will use wine barrels once or twice, and some will depend upon using new barrels. These are very expensive and add significant cost to the manufacture of wine, whereas stainless steel tanks, shown here on the slide, can be used virtually indefinitely and appropriately cleaned. And most of the cleaning and the use of stainless steel by winemakers, in fact, comes from the agricultural industry and the manufacturing, or not manufacturing, but the storage and cleansing of milk and other agricultural products. So stainless steel vineyard tanks are now commonly used all around the world for fermentation of grapes. Now, if you're setting up a transplant unit, you have to make a number of decisions. First of all, I think everybody agrees that reverse isolation is essential. When I was working in Seattle in the early 80s, laminar airflow rooms were used. I would have to say I'm not a fan of these rooms. The difficulty was getting into the room in a full change of clothing, and as a result, doctors and nurses didn't go in as frequently, and patients felt more isolated. So, and the difference in terms of outcome wasn't really significant. So I think if you're setting up, they're also very expensive to operate. If you're setting up a transplant unit today, I think it would be safe to say that you do not have to install laminar airflow rooms, but be very careful in terms of reverse isolation. One of the problems I had or questions I was asked was, would staff be allowed to wear jewelry, as of course that can be contaminated with bacteria or fungi. In my opinion, staff should not wear jewelry, although wedding rings were allowed. But this is an arguable point, and people may have different points of view. Strangely speaking, the most difficult thing I found, and I think a lot of people would agree, is good hand washing. Now, thorough hand washing would seem a very simple thing to do, but it's amazing if you sit back and watch people washing their hands going into a transplant unit. The poor technique that both the visitors and the staff use is truly shocking. So you really do, it really is like having children. You have to keep after them all the time. And I think that thorough hand washing is probably the most important thing you can do. In our transplant unit, we wore a plastic apron and thorough hand washing. and a mask, but nothing else, and didn't go in for any particular PEP. The vaccination of staff is a highly contentious area. And it again amazes me that some staff members are resistant, and that I'm probably talking mostly about nursing staff, are resistant to vaccination. We would say that certainly vaccination against influenza and COVID and hepatitis B are essential for nursing staff to work in a transplant unit. As I say, this is a highly contentious issue, and some staff members refuse vaccination, in which case I think they should probably be excluded from looking after patients. Patients in pediatric transplant units where RSV is a problem should be vaccinated, and that is becoming more available now in the last 12 to 24 months. So vaccination for RSV for pediatric nurses, the vaccination for hepatitis B, COVID, and influenza in adult units, I think should be mandatory. Now, the other question is, how do you harvest grapes, first of all, and stem cells? Well, there are two ways you can harvest grapes. One is so-called hand harvesting, where the individual is employed to cut the grapes, does so by hand, and is trained to inspect the clumps of grapes before cutting them. In larger vineyards, that is those who would be maybe making more than 50 or 100,000 bottles of wine per year, and who have very large vineyards, then mechanized harvesting can be used. I don't know if there's any comparative data between the two, although in general, when I'm buying wine and get to know the winemakers, I usually rely on grapes that are hand harvested. The other thing about hand harvesting is that you can try to get the same people to do the harvesting for many years, and as a result, they become very well trained and know exactly when and what to harvest. Now, when I started hematopoietic stem cell transplantation, we used bone marrow, and a lot of transplant units still use bone marrow. However, the spectrum has widened considerably in the last 10 to 20 years. Many units now use peripheralized, mobilized peripheral blood. And one without being too cynical, of course, one of the reasons might be that it is much easier for the physician to order mobilized peripheral blood instead of bone marrow, as this is usually done by non-medical staff. Whereas the harvesting of bone marrow is a laborious procedure, taking an hour or an hour and a half, depending on the donor and whether they're obese or not. So it's maybe the reasons for doing so are not as clear-cut as they should be. The other fashionable way of harvesting stem cells is the use of umbilical cord blood. Now, although umbilical cord blood was known to contain pluripotent stem cells, it took a long time before umbilical cord blood could be used. And although there are, Elian Gluckman, I think, in France, probably did more to pioneer that than anybody else. And although there are many umbilical cord banks, and they are quite expensive to maintain using liquid nitrogen, and a very, very good system of identifying individual umbilical cords, volume tends to be a problem. So using one umbilical cord for a 150 kilo man is probably not adequate. So size does matter. So in many cases, more than one umbilical cord has to be used. And in general, the uptake of umbilical cord blood is not nearly as much as we had hoped it would be when the technique was initiated. Now, people who were involved in hematology and in transplantation think that they're the only people involved in clonality. We know that hematopoietic cells may be clonal in a number of leukemias, although it doesn't actually have much of an impact on the type of treatment that is used at present. And of course, clonality in terms of hematology does not always imply that orders are malignant, because, well, particularly paroxysmal nocturnal hemoglobinuria, or PNH, and CHIP, or CHIP, or clonal hematopoiesis of indefinite potential, are areas which are probably benign, but are definitely clonal. However, people who are involved in making wine are also heavily involved in clonality, and it is extremely important for them to pick vines that have been identified as coming from clones which make good quality wine. And why are they so uptight about that? Well, first of all, they need to talk to an experienced enologist who's a local person who knows the clone of the grape which produces the best ones. And the same grapes in different clones may have different sizes, different degrees of acidity, different levels of tannins, different sugar levels, and different color levels. So therefore, clonality is extremely important in terms of the final product. And this is more important in some wine cells, particularly Cabernet Sauvignon. The clone B777 is particularly famous, and a lot of people would use this because it is associated with making Cabernet Sauvignon of the best qualities. Now, another decision which can be made, which has to be made, is what sort of label to use and what sort of container. Well, again, this may not seem very important, but some vineyard, well, if you talk to people in wine shops, they will say that just like books, the cover of a book often helps to sell it. The wine label often helps to sell the wine. This is a wine label here designed by a famous German artist, the late Tommy Ungerer, for a vineyard called Nitardi, which is in Tuscany. And as you can see, he is playing the pipes of Pan, and there are a number of ladies with their bottoms in the air and their heads buried in the grapes. You should know that this particular wine, although designed by a very famous artist, was banned in North America as being indecent, and they had to design a certain label. So many vineyards and many winemakers do, in fact, employ famous artists and pay a lot of attention to the wine label for aesthetic reasons, and also, as I said, for the reasons that attractive wine labels certainly help to sell wine. There has been a move away recently from the old wine labels, which had castles and towers, etc., to more abstract designs. And this is, again, a matter of opinion as to which one prefers. But as I say, many famous artists are used by many winemakers to design their labels. Now, what sort of container to use? Well, it's a subject of a lot of controversy at the moment. There are different wines. This is a standard wine bottle here. There are different shapes of wine bottles associated with different areas. And one of the irritating things about winemakers is that not all wine bottles are the same size, which makes storage very difficult. And secondly, some wine bottles are bigger and heavier, which of course increases the cost of transport and increases the carbon footprint. And this is done in the belief by some people that larger and heavier bottles contain better wine, which of course is totally untrue. The larger and heavier bottles do not make better wine. The bigger the bottle, the better, okay? That's why one should avoid very small bottles. and try and consume wine from magnums if you can afford that. In terms of stem cell transplantation, well, the storage, the cryopreservation of marrow, which is used for autologous grafting, is pretty well standardized by now. In terms of the straightforward allogeneic stem cell transplant or mobilized peripheral blood stem cell transplant, then storage is not a huge issue. Now, this is an area which is very dear to my heart, and its price. First of all, a lot of people judge wine, the quality of wine, by its price. And here I've shown a bottle of Sassicaia wine from Tuscany, which sells for many, many, many hundreds of euros per bottle. And here is a picture of the man, Mr. Takis, who actually made this wine initially. And he was asked once, why do some people spend $20 on a bottle of wine and some spend $200? And his answer was, because they're stupid. So people think that the more you pay, the better the quality. Now, there's a certain element of truth in that, but you can get very good wines for $20 or less a bottle if you look around carefully. So don't be fooled. If you're paying $200 or $300 a bottle, then usually the wine is quite good, but most people do not want to spend that money. How does that equate to transplant unit? Well, it is very, very dear to my heart that hematopoietic stem cell transplantation, which is curative in many patients with incurable leukemia, should be available to those in need and not on their income. And unfortunately, and sad to say, this is not true in all units, in all countries indeed. In some countries, transplantation is available in private practice only at a huge cost. And in some countries, it's available to those on need. So if you're setting up a transplant unit and dealing with state agencies or whatever, I think it is very important that we as doctors and hematologists try and make sure as best we can that this so-called life-saving, complicated, tricky procedure is available to patients who need it and not only on those who can afford it. And that's a real hobby horse of mine. Now, the other area which has come into more contention, shall we say, recently, is when to harvest grapes and when to offer a transplant. Well, in terms of when I started transplantation, everybody with acute myeloid leukemia in remission was transplanted, and adults with ALL in second complete remission all were offered allogeneic transplant. This has become more nuanced now, and this is why access to a molecular biology laboratory at diagnosis may be helpful in deciding, excuse me, which patients have a better prognosis and may have a reasonable chance of cure with standard chemotherapy, and which patients should proceed on to hematopoietic stem cell transplant. Not all laboratories have the facility for this or are able to make a nuanced diagnosis, but it is becoming more common. And hopefully over the next couple of years, and with the advent of immunotherapy as well as chemotherapy, the molecular biological diagnosis molecular biology at diagnosis may become more helpful in terms of deciding which patients need to proceed and which patients do not. Harvesting of grapes, it depends on where you live. Obviously in Europe and North America, it's usually in the summer or autumn, August, September, October, whereas in what we commonly refer to as a New World, Australia, New Zealand, South America, South Africa, it's usually February and April. However, and this is important to say, it is very important that the farmers who are harvesting the grapes take cognizance of local weather. For example, hailstones, which may occur in July, in the usually very sunny times, for example, in Tuscany, can cause devastation to vineyards and can wipe out a whole vineyard in the space of 15 or 20 minutes. So local weather is important in terms, as we said earlier on, of infection. Moist, a lot of rain enhances the risk of fungal infection, etc. So a knowledge of the weather in the area in which you're harvesting the grapes is extremely important. So the vineyard owners need to know about weather conditions as well as infections, as well as the tonality of grapes, and that will all help them to decide when to harvest the grapes. Now, the two things that are extremely, that are very common to both stem cell transplantation and making wine is that you have to wait a long time. When people make wine, they ferment it, they keep it for 1, 2, 3 years. And in certain parts of the world, particularly in Bordeaux and Burgundy, it may be kept for a long, long time. And recently I see that Champagne, which was underwater since the middle of the 18th century, was recently opened and was indeed was excellent to drink. So you may have to wait a long time. And if you're selling what are called boutique wines, it may be a long time before you get a return for your money. Is that true in transplantation? Well, it is true. Unfortunately, relapse is still the major problem associated with transplantation for malignant hematopoietic disorders. And as we know, unfortunately, relapse may occur many, many years after apparently successful transplant. And this may vary from different types of leukemia, and is particularly important in chronic myeloid leukemia, although the use of TKIs has completely changed the outlook for these patients. So it takes a long time before you can relax and know that a patient has indeed been cured of the underlying disease by a stem cell transplant. And as I say, relapse may occur a long, long time later. And lastly, but not least, and probably most important of all, you need two things. First of all, you need a certain amount of expertise. And the only way to gain that is to work in a transplant unit, see what's going on. I learned to be a transplanter in the University of Washington in Seattle, in the Fred Hutchinson Cancer Research Center. And that, although it was very hard work, was a fantastic experience. If you want to open a vineyard, then I suggest that you work in well-known vineyards in whatever part of the world you're living. Or if you're living in Europe, you may go to North America and vice versa, or Australia or other parts of the world. The second thing you need, and which is very hard to quantify, is that you need to be enthusiastic. There is no doubt that making wine can be a very profitable business and can be a very hazardous and difficult business. I, at one stage, had thought of investing in winemaking with a good friend in Tuscany, and he advised me not to. He said, unless you have a very large amount of money to lose, don't do it because it's too uncertain. If you want to open a stem cell transplant unit, you need to be enthusiastic. It's a bumpy road. It's an expensive road. It's difficult to get staff. It's difficult to keep staff. It's difficult not to let staff get burned out. I was a transplant physician for about 20 years, and that's probably long enough for anybody. So the two areas are important and that are difficult to quantify are expertise, whether it's growing grapes or transplanting patients, and enthusiasm in terms of in one case, the enologist or farmer, and in the second case, the transplant doctor. So with those few words, I think I hope anyway, I've convinced you that opening a vineyard and opening a transplant unit, although they're quite separate issues, and one is a matter of life and death and the other is not, they still have many questions to be asked, and there still are many similarities between the two. And in the meantime, please enjoy your wine over the festive season. Thank you.